Hello, this is my presentation on Chapter 19. So this is about the infectious diseases on the skin and eyes. So your integument system, this is like your skin, your hair, nails, and oil glands. So a little bit about your skin. The thickness varies, so on the back of your hands it's very thin, whereas on the soles of your feet it's thick. So these infectious diseases can enter through abrasions in the skin. A lot of them can. So you want to, people with dry and rough hands that crack easy are really susceptible to these diseases. So keratin is a protein and it's found in the epidermis, so the skin, and its defense system. So skin is the first line of defense and it usually is good about not contracting diseases because of its ability to defend itself. It's so thick and it has a really good defense system. Okay, so here's some diseases of the skin. So MRSA, it's commonly found in the hospital. For MRSA, you usually have skin lesions. It can be infectious in the bloodstream if left untreated, and it is usually resistant to a lot of antibiotics. So Staphylococcus aureus, it grows in clusters like grapes. It's non-motile, and it has an array of super antigens, so it's highly virulent, and it appears as normal biota of the skin. It can also appear on healthy people. So MRSA signs and symptoms. So for this disease you have raised, red, inflamed, and localized lesions. Usually you have pus that comes out of these lesions, and it occurs in breaks in the skin, usually by shaving or cracks. Symptoms would be like a fever, that's common. It's directly spread, contact precautions, and a diagnosis. So you do a polymerase chain reaction. And to prevent this, it's commonly taught to have good hygiene. Okay, so the next disease is impetigo. So the signs, transmission and diagnosis. So it is superficial. Some signs, it causes the skin to flake off. It's not serious, but it's highly contagious in children, and it is caused by other infectious diseases. So a sign would be honey clustered crusts. It's found around the mouth and extremities. It's very itchy and is spread through direct contact. It's usually found in the summer and fall, and it's usually diagnosed by visual inspection, and it can be treated with antibiotics. Okay, so cellulitis. So this is also commonly seen in the hospital. So some more signs, treatment, and diagnosis. So it's very fast spreading, and it's of the dermis. Some signs you would see: pain, tenderness, swelling, and warmth. So kind of like an infection, signs and symptoms. So a common sight to see is red lines leading away from the area, the affected area, And what these are microbes that are being carried to the lymphatic system. So it's a pretty cool thing to see. It can cause septicemia if left untreated. Bacteria or fungi can enter into the dermis through trauma or subtle causes. It can also enter through breaks in the skin where fungus is present, so it's common to see it in athlete's foot people. So those who are immunocompromised are at a higher risk. So usually this would be a secondary infection to a larger one. It is usually healthcare associated, and it does respond to oral antibiotics. So then you have your gas gangrene. So signs, treatment, and diagnosis. So this disease is anaerobic. So you can there's usually endospores in the soil, skin, and your intestine. It's usually found in muscle tissue, and gas spreads as the disease continues to progress. So again, it's toxins in the large muscles. They can diffuse into the tissues. It can progress through the entire limb and usually has to result in amputation. If amputation or if the infection is not treated right, it can lead to death. It can get septic and easily be fatal. So usually you see pain and edema. So one way this disease is contracted is through surgery, fractures, ulcers, etc. And if you think you might contract this disease, it is encouraged that you vigorously clean the area, and also if you have wounds, repair wounds fast. Okay, so you have your chicken pox. So this disease is usually not serious, but can be fatal in immunocompromised, so it should be taken seriously. There's a vaccine to prevent this, and is usually encouraged in small children. It is extremely contagious, and it takes about 10 to 20 days before you find your symptoms, and usually you see a fever, a rash, usually on the scalp, face, and trunk. You see skin lesions start to appear, and you can have more than 100. So it usually is more in the center of the body, and it usually resolves in 2 to 3 weeks. So if a pregnant patient had this disease, it can cause fetal infection and be very serious. Okay, so shingles. After having chickenpox, you can get shingles. So usually this affects one side of the body and stops at the midline. This is a very painful disease. Development after the chickenpox virus is reactivated. It can be spreadable through droplets, so respiratory droplets. It's infectious a day or two prior to the development of the rash. There's a vaccine present for this disease, and usually therapy is the alleviation of discomfort during the time it's most prevalent. Okay, so smallpox, again, symptoms and treatment. So, don't get it confused with chickenpox. Usually it begins with fever and malaise. You usually see a rash in the pharynx, and it spreads to the face and then the extremities. It is important to recognize early signs so you can get treatment fast. Cause is a DNA virus. So infection begins by the implantation of a virus in the nasal mucosa, and it is encouraged that you receive vaccination. It is present. So this is hand, foot, and mouth disease. So it is most common in babies and children under 5. You usually see it in the primary school and small children. It's very, very contagious. So usually your symptoms would be a fever or a sore throat. The first spots appear in the mouth before blisters appear on the soles of the hands and the feet. It is caused by many different viruses, and there are no treatments or vaccines. So usually when kids contract this, you usually let it run its course. It's spread directly and through droplets. Okay, so moving on. So then you have your maculopapular rash diseases. These are more of your major manifestations on the skin. So these skin eruptions are described as maculopapular. So there are a few diseases that I've put on the PowerPoint that are these maculopapular rash diseases. Okay, so measles, starting off. So measles, the incidence of this disease is increasing in the United States. Usually your signs, you would see a sore throat at first, a dry cough, headache, and then later signs you would see white spots in the mouth. They begin on the head and then they go to the trunk and then the extremities. Can develop, they can develop secondary infections, and if not treated, they can enter the bloodstream. So they are most contagious through droplets. So they are spread through by crowding and low health care. So usually diagnosis can be observed through clinical presentation, and there is a vaccine for this, and it's called the MMR. So next you have rubella. So this usually occurs with a minor rash and few complications. However, it can cause serious damage in a fetus. So this can cause postnatal infection in small children and adults. Usually incubation is around 2 to 3 weeks. Usually you have malaise, fever, sore throat, and more. So papules usually appear on the face and then they spread elsewhere. Okay, so then you have ringworm. So this is a fungus. It is usually easy to diagnose because it looks like a ring, just a kind of like a ring on your skin. It is not caused by a parasite. It is just a fungus. So it's usually easy to diagnose, but it might need a culture because sometimes it can look like other diseases on the skin. So usually you contract this by having bad skin hygiene and through contact. Like if somebody who had this disease shared gym equipment, they can easily spread it, or wrestlers. So it has a long incubation period and can be acquired from the soil. So you need to avoid contact with this. Also, the host can be a carrier of this, and it can spike up, and the ringworm can return. So lastly, you have your superficial mycosis. So it usually occurs on the epidermis. You usually see cosmetic effects, and what this is yeast that feeds on oil glands. So the skin may appear as mottled. Young people are frequently exposed to the sun can contract superficial mycosis. So an interesting fact is that it can be found in the pancreas and is often associated with pancreatic cancer.